Hi, we're talking today to Robin Eagle Sage. Robin is a clairvoyant and a medical intuitive. Hi, Robin, how are you?
Good, how are you?
Very well, thank you. Robin, can you tell me today a little bit about what is clairvoyance, what is medical intuition, and a little bit about your personal journey?
Sure. Clairvoyance is the ability to see energy clearly. It's a French word. It means clair means clear, and voyance means seeing. And so in order to do that, I basically close my eyes and I start to see colors and pictures in my mind's eye just the same way that you do when you're sleeping at night and you're dreaming. And so depending on the question that I ask, I see different answers and different colors. So there's clairvoyance, there's also clairaudience, which is where you hear things, and clairsentience, which is where you feel things, and most people are clairsentient. And so medical intuition is using all of these skills in my case, and for the purpose of diagnosing illness and finding blockages in the body, parts of the body where there's not as much flow. And if you can catch these things when they're still in the energetic form, then you can heal them very easily. And if you don't catch them when they're in the energetic form, they eventually will turn into a physical mass or a disease. So,
do most people come to you when they already know that they're ill, or do you consult with somebody and then advise them about an illness that you are sensing or that you see?
There's so many different cases. Some people call me and they have a lot of symptoms, but the doctors haven't been able to find out what's the problem. One guy called because he had a sinus infection, and when I looked at it, I saw right away in his nose he had cancer. And so I told him, and he went to the doctor, the next day to get it checked, and sure enough, he did have cancer. So when I see these things, then I go into how to heal them. So that's my question that I ask, and then I'll see different colors, and I'll open up those colors, kind of like the way you open up a screen on a computer, and look at what those colors mean. And so there'll be everything from, well, firstly, I find out what's causing it. So in his case, what I saw was the ceiling above his head in the office. I saw those big white square things that you can lift up, and there was asbestos in there right above his head, and the AC was blowing it all around and causing this cancer for him. And so obviously it's good to know the cause, but actually that's just the physical cause, but then there's also the emotional cause, which we go into. That's the most important, really, because it starts always with the emotional, and then the physicality will just appear to help you out, to help you form this disease. So we, from there, of course, after we know what's causing it, then we go into the cures of it, and they can come in the form of supplements, exercise, emotional things that need to be changed, mental things that need to be changed, just the whole gamut, the whole spectrum, because people are whole, and so we can't just look at, supplements or food. We have to look at everything that's going to actually bring this person into balance.
So do you tend to have more than one session with a person?
It depends. If someone has, I have one client that has heart issues, diabetes, overweight, lots of things going on, and has had a lot of trauma. We absolutely do more than one session, and, for people to think that, they can be healed in one session is a little bit impractical because it takes people a long time to develop an illness. And so you can't just think that it's going to go away, in one session, or that, you can just take some pills and it's going to go away.
Are you able to work with people over Skype?
Sorry, I can't hear you.
Are you able to work with people over a medium like Skype?
Yes, that's the way that I do work. In the early days, I would see everyone in person, And then I realized, it's really not necessary because I'm reading their energy and I'm reading it in my mind's eye. And my eyes are actually closed, so I really don't need to have them in front of me, which a lot of people think is odd, but it's just the truth. And sometimes I actually get a more pure read when they're not in front of me because I'm not going by their looks or anything like that. So yes, absolutely, I work all the time over the phone or Skype.
Thank you, Robin. Thank you very much for talking to me today.
Thank you.